record software that is to transit healthcare from a primarily paper-based record-keeping system to electronics. This is the first to be developed locally in Uganda, and no internet is required to run it. So to explain that and how this particular software works and its benefits, so to speak, and what will trickle down to the health sector across the country and across the globe, hopefully, is Mr. Samuel Mugisha, the Director Innovations from Innovation Streams Limited. Thank you so much for making time and welcome to Morning at 10 TV.
Thank you for having me.
I think this is some good news for the country. Moving from the usual paper-based kind of records to something that will cut across. You started from the Western region. It's amazing to see that now they're going to be using computers. Tell us more about this.
Yeah, good morning, viewers. I'm Samuel from Innovation Streams Limited. We partnered with an amazing hospital in Uganda, Chisizi Hospital. That's way back in 2013. And the idea was the mission was really to organize Uganda's healthcare data so that patients can access quality and affordable healthcare. So we've been on this mission and we've developed an electronic health platform that clinicians can use to make sure, one, that they give quality healthcare. We are very, very strong on patient safety, no harm to the patient, while gaining all the other benefits of electronic records. Effective management, effective drugs management. You can access patient records whenever you want them, just through a click. Very fantastic, and very many other things that we've put in, like the community health insurance model of Chisizi, which is very, very exciting. So we've done this for the last 7 years. We've been in the labs for about 6 years, trying this, engaging with different stakeholders, and now we are bringing it to people. We are showing it to health workers and telling them to have a look and adopt it in their hospitals, because it's actually exciting.
So you're going to be having a conference, but we'll get to that later on. But tell us, you're saying that now you're opening it up to all the stakeholders and faculties in this particular sector of health. How will that happen? Should someone pay for this particular software? What will happen in terms of other sectors or other establishments pretty much borrowing this and having this in their institutions? What will that take?
Yeah, it takes a lot. Adopting electronic health records is really a whole change management process. Hospitals have to have computers. We've put up installment plans and help to make sure they get this infrastructure in place. Yes, they pay for our software. We have.
How much are we looking at?
We have a mixture of licensing and subscription model. So one can get a software for free and then pay 1,000 shillings per patient per year. You can get it for free and pay 1,000 per patient per year, or you can opt for a license where you get a lifetime license, and depending on the number of users in your hospital, it's really pretty much from Uganda shillings 3.5 million to about 30 million, depending on the size of the hospital. But that's a price that is really unbeatable. If you look at the cost of electronic health records in other countries like the United States, it's ridiculous. It's very, very huge, billions of dollars. So this is a cost that we think most health facilities can afford, and we are really very flexible, because really the goal is making sure that patients receive quality and affordable health care. That's the main goal. Is
the Ministry of Health ready to buy into this, especially knowing that you first worked with a rural hospital, and for other rural hospitals to embrace this, you're saying there's a cost factor to that, but is the Ministry of Health ready to foot this particular cost?
Absolutely. We've had talks with the Ministry of Health. The last one that I had was with the Director General of Ministry of Health, Dr. Mwebesa Henry, and they are looking at this. Of course, if it's massive number of hospitals, then the price goes down, and we are looking at all ways really of bringing this, even considering making it open source, as long as it gives the patients the quality and affordable health care that we all deserve.
All right, so before we get into the touch screen, so you can practically show us what's unique about this particular software and how it works. Just give me pointers. We know different hospitals here in Kampala, them that can afford it, now no longer use files that he, go get a file, a hard copy file of patient XYZ. Most of them are on the e-platform. They do this in computers. They have softwares to do this. So what is the added advantage to this software of yours?
Absolutely. The number one added advantage is patient safety. According to the World Health Organization, actually patient harm is the 14th leading cause of the global disease burden. That is really comparable to diseases like malaria and tuberculosis. So what this means is that actually when patients go into a hospital, they acquire infections in the hospital, they are prone to error in the medical process, and this is a huge global burden. Actually, according to World Health Organization, 1 in 300 people who go to a hospital is at a risk of acquiring healthcare related infections and harm. So we are saying, when you're giving care, make sure there is no harm to the patient. So what we've done in our software, we've put in a lot of patient safety features. Prompts, these are like an assistant. When the doctor is working, the prompts are telling them, don't forget this.
Okay.
Make sure you do this. We see this a lot in the aviation industry.
Yes.
There's only 1 in a million chance of you getting harmed in the aviation industry, but they are very, very serious with patient safety. And we need to be very, very serious as well in healthcare, where there is 1 in 300 chance of being affected. So we have patient safety features, we have resources for health workers. Health workers spend 6-7 years in school.
Correct.
And when they see a patient, we expect them to remember everything they learned and diagnose the patient.
Right.
That doesn't happen always. Besides, medicine is changing. So what we've done, we've embedded crucial resources in the software that clinicians can refer to and use anytime, refresh themselves, real-time updated information to keep them learning all the time. And maybe the most interesting one is the community health insurance. The biggest challenge we have now is that as we talk right now, someone is selling off their land because they have to pay for healthcare.
Yes.
Someone is taking a loan because healthcare is expensive. So Chisizi Hospital, an amazing hospital, has run a community health insurance for the last 25 years. 42,000 patients on the insurance scheme, and they pay between 12,000, 17,000 a year. That's premium for a whole year.
Right.
So 42,000 people come together, they collect these premiums, and when they go to hospital, they pay co-payments, which are really low cost, and then they access health care.
Okay.
So the idea is that nobody should really suffer by paying huge medical bills. We can work as a community and take care of each other. And this model is in the software as well. And we're saying, we can take you through how this works, work with the local communities, and help people get affordable health care.
We'll do that practically. I'm actually burning to go to the touch screen so we can see how this actually works, or how these 3 pointers come into play, and especially that one for updating health care workers on information that they could have missed out on. That one I think is critical, and the safety bit. So please allow us to take this short commercial break so we can head onto the touch screen. Stay with us.
Now that the performance of boys is going down and the girls are coming up, who is to blame?
It would be okay to fail the UNEBs of this country, as long as you don't fail in life.
On the other hand, you also find that the boy child quickly has got to start to earn a living because his dad is drinking himself stupid.
Even at 13, a child has been in boarding school. People out there will say, oh, they're more resourceful, but they also have more rotten manners.
Does money make a man, or does man make his money?
I just don't want to hear it as a leader that money makes a man. How?
People keep finding themselves in difficult situations about money because they end up spending more than they earn.
Have you ever heard of the phrase that women are their own worst enemy?
We have people who say that women in uniform are not marriage material, but it hasn't stopped us from being women.
Most of the men would prefer that the women remain in the current status or even worse.
When the car was rolling, it banged, I think, a ground of sorts, and then it jumped into the sky. I lost my consciousness. I didn't know what was happening at the time. is Karim Makumbi. I was driving from a burial. When a border guy got into the road, I dodged him. The car never touched him, but then we lost control. I lost control of the car, and then that's how we overturned. I got injured. I broke my neck. I got injuries on the head. My arm was dislocated. Something had happened to the spine. Doctors told me I would get paralyzed. A lot of things they were explaining. What I learned at that point in time, you're on the road and you're fast, and most of us would actually think you have control over the vehicle. Some things happen and you don't have control over them. Think about your life. Think about what could happen in case you lost a life. That would be the end of you, and there are many people around you, perhaps children, a wife, family, and loved ones.